Hi, in this video I'd like to talk about why we need to put an emphasis on any miscarriage that you experience in your pregnancy history. So especially for those who have miscarried for the first time, this is something that you should take very seriously regardless of what your doctor might say. So in our experience, patients come with a history of several miscarriages. We've also have had patients who have miscarried 10 to 12 times, and they have not sought the proper treatment and diagnosis, screening and tests that they should have done in the first few, but they waited for the 10th miscarriage to only seek treatment. So for their case, although they can still get a healthy pregnancy, diagnosis and treatment is far more complex now. It will take a lot more time to figure out what exactly has happened within these 10 miscarriages. And then we cannot actually guarantee that success is a reality that we can promise to you, because the condition has been developed into something very complex, and it's no longer something that is simple in nature. There's probably several factors involved now, and as we know, miscarriages are up to 45 individual causes. The more times you miscarry, the more complex it gets, and then the more additional factors that might pop up. So if you take away any message from this video, is that if you have miscarried for the first 1 to 2 times, please immediately seek assistance, medical assistance, especially a specialist that can actually take your case seriously. Most doctors will just simply disregard your first miscarriage, and then they can say something like, these things, they will happen sometimes, it's just some bad luck that you are experiencing. The next time it will definitely be a smooth one for you. Now, although it does happen, but in most cases you'll most likely be miscarrying again. And if you keep following your doctor's advice like this, you'll be miscarrying repeatedly, and then the condition will get more complex, more difficult to treat, and then eventually you might not even be able to have a pregnancy anymore, because you might develop into something serious. You may need to go for a hysterectomy. It may become infertility, or you may have actually missed your fertile periods because you have just miscarried over the years for over a decade. So these all have happened. So we want to take this video to actually advise you to take it very seriously. Any miscarriage that you've experienced, get it diagnosed, get it treated. The first 2 miscarriages can be diagnosed and usually are very simple in nature. Probably there is something wrong with the uterus. You might have an immunological factor, and these factors are usually just 1 or 2. Not very complex, easy to treat, and successful pregnancy is definitely can be a reality for you. So if you want to find out more information about miscarriage diagnosis and treatment, please visit our website. If you have any questions about this topic, please leave them down in the comments below.